And welcome to the first podcast for the Alberta NEIHR Indigenous Primary Healthcare and Policy Research Network. My name is Anika and I'm a research assistant with the network, and today I'm joined by 4 other people who will discuss what the network means to them.
My name is Lindsay Croshoe. I'm a family physician. I'm from the Piikani Nation, and I'm a researcher at the University of Calgary, and I'm the nominated principal investigator of the network.
I'm Cheryl Barnaby. I'm a member of the Métis Nation of Alberta, but originally from the southeast region of Manitoba along the Red River. And I'm an associate professor at the University of Calgary in the departments of medicine and community health sciences. And I'm a co-PI on the NEIHR grant.
I'm Stephanie Montesanti. I'm an assistant professor in the School of Public Health at the University of Alberta. And I'm a co-PI, co-principal investigator on the Alberta NEIHR network. And I co-chair our Truth and Reconciliation Working Group and our Indigenous strategy within the School of Public Health.
Third weasel traveler, Bastine from Piikani Nation. I'm just the old man here.
To give a bit of background information, the IPHCPR network was established to promote a renewed and transformed primary healthcare system to achieve Indigenous health equity. Aligned with principles and health legacy calls to action advocated by the Truth and Reconciliation Commission of Canada, our network will advance research that links knowledge to policy and practice, fomenting evidence-informed systems and innovations based in equity and Indigenous ways of knowing. My first question is for Dr. Croshoe. Could you please give us some more information on how this network came to be?
Thanks, Anika. How it came to be, that's a bit of a long story, but I'll make this quite short. In a nutshell, it was a very nice collaboration amongst a host of colleagues that I work with in conjunction with community leadership and the health system. So various components of the health system, which includes Alberta Health as well as on reserve health systems and First Nations Inuit Health. So it really emerged out of a host of conversations over many years. And also, as a physician, as a family doc, I've been in the system for 20 some years, and I have been trying to observe the issues that were out there and try to understand what was going on. And I've had the privilege of taking on leadership positions within AHS as well as within Siksika to lend a hand to think about how can primary care best be modeled to create high quality and better outcomes for the community. So using those sort of lenses, I worked with a host of colleagues, and we started to ask the question, how can research help to support and mobilize primary care forward to enhance quality, enhance care, help to provide better health outcomes? So we started off with an early community gathering that started to shift the way in which we discussed and explored, and we looked at innovations. With the release of the Truth and Reconciliation and the calls to action, we looked closely at those calls to action and saw frame some guiding concepts and principles and directions that allowed us to have another set of conversations with community to start more clearly understanding what it was that primary healthcare could be doing, what is the direction it could take, and how can research help frame that. So that, in a nutshell, is where this network came from.
Thank you, Dr. Croshoe. My next question is for Dr. Barnaby. What are some thoughts as you position yourself in this network, and as a PI for the AIM High network, what are some connections and opportunities you see for progress?
So first I'll speak to the potential of this NEIHR. And I think it's really an incredible opportunity to take actions that build health and wellness in community. We tend to focus on the place where care is most costly, which is the hospital or in specialty care. But in fact, most people will be interacting with primary care and in community. And this is where a strong investment and applying evidence-informed care approaches can really make such a huge difference to build community wellness. And so we are able to bring so many different disciplines and specialty groups and primary care groups together in this network to really advance health and ground that in strong primary care policy. My second role in this network is to bring in some of the lessons we've learned from the past 4 years that we've had the Alberta Indigenous Mentorship and Health Innovation Network together. And so over the past time, we've been able to build a real strong cadre of Indigenous graduate students and principal investigators who are quite committed to approaching research and wellness from a strengths perspective. And a lot of these investigators will actually be maturing and moving into taking on PI roles during the time that the NEIHR will be in place. So we've already got a great group together, and I think there'll be really strong contributions that all of those people will make together. We've learned how to pull together some of those wise mentorship practices to also ensure that we're growing and supporting each other, and also quite adept at running events and activities that will help support the emerging Indigenous scholars.
My next question is for Dr. Montesanti. What are some thoughts as you position yourself in this network? And as a health policy researcher, what are some key priorities the network can foster in supporting health research in Northern Alberta?
So primary healthcare is the cornerstone for an effective healthcare system. It's the first point of contact for patients when they access healthcare, health services. And I also want to make the distinction between primary care and primary health care. Within our Alberta NEIHR network, we are emphasizing primary health care, which is that broader definition that encompasses the social determinants of health and health equity. The research supported and generated through our Alberta NEIHR network will help to critically explore policy alternatives that inform the delivery of primary health care for Indigenous peoples in the province. And within our network, we will support training and research capacity and policy research and analysis, which is really important to take a critical lens at how we deliver primary healthcare services to ensure that it meets the needs of Indigenous peoples in communities. It's important that our network also supports training, mentorship, and research that fosters more of a holistic understanding of policy that encompasses mental, spiritual, physical, and emotional well-being, building on the strengths within the communities and the capacity within the communities. So our approach to Indigenous policy research really fosters engagement with Indigenous peoples and their inclusion in setting or determining those health policies that also reflect the distinctiveness of Indigenous communities and experiences throughout Alberta.
We've saved the last question for Elder Leonard. Could you please elaborate on what you see are the opportunities and priority areas that this network can offer?
So there has to be an education and awareness to be stepped up. I don't know where to begin, because in my community, when I go home and I listen to the director of health, the first thing I hear from his lips is a program that covers every area. And then I look at the community itself, and then I have my own opinion that my God, there's so much that needs to be done to improve the health. There's so many areas that have to be looked at. So research to me is so critical. It's so needed. I appreciate what you guys are doing right now with this research work, and I have faith in it that it's going to bring out, a plan that's going to make a difference. So thank you for inviting me to be a part of this.
Is there anything else that anyone would like to add before we wrap up?
So I think the ideas that we put forward today include this notion of innovation, and the fact that there's a lot of knowledge out there in the community, that there's a lot of skills, a lot of knowledge that you develop, but often it's hard for us to share it across from site to site. So the opportunity that this network provides is a chance to hear out, listen, bring together innovations from across Canada, maybe across the world. Because each place often has strengths, but they also have some needs for knowledge. And so this research network will help to fill in those gaps, I think. I think that when we think of Indigenous health in the primary care setting, there's some specific knowledge and some very specific skills that go hand in hand with providing excellent care. Somebody just graduating, they have a ton of excellent skills for general application to patient care. But when you work with Indigenous populations, there's another layer of very distinct knowledge and skills that's connected to culture and cultural concepts, as well as to how colonization creates a specific context. And it takes time to understand that those very concepts have underlying principles that can be applied to bigger picture issues within the healthcare system, all the way up to policy. I think that this network has the opportunity to identify what those concepts are and put them on the table so that people can then engage with them, so systems can engage with them, and we can start building knowledge based on those principles and based on those innovations that we see across Canada, because I think they're tied hand in hand. So for me, that's like the exciting part of this is mobilizing the strengths that we have and seeing the distinctiveness of a specific knowledge set that is inherent within primary care when focused on Indigenous populations.
To conclude then, the IPHCPR network will support researchers, health systems leadership, health service providers, and Indigenous communities to come together to build knowledge for improving primary healthcare for Indigenous peoples.